I'm just much of the stuff I'm gonna talk about was fortunately already been touched by, by the other speakers. So again, I am Dr. Marq Mutia. I specialize in internal medicine. I'm from the Philippines. Uh, just the basics about medical cannabis that every advocate should know. So I am the founder and president of the Philippine Society of Cannabinoid Medicine. So uh, as we know, Asia is the purported birthplace of cannabis. Cannabis evolved 27 million years ago, no, in Central Asia. Uh, it wasn't until 20,000 years ago that Southeast Asia was split into the different countries. So before, Southeast Asia was one continent, and you have 27 million years for cannabis to spread, no? Uh, I say this because I'm happy someone mentioned the co-evolution of humans and the cannabis plant. No, I heard it here, I think, yesterday. So, and as we all know, cannabis has been used as a medicine for thousands of years already. First, in Eastern medicine, Chinese and Indian medicine. So, as early as 1843, cannabis was already in the scientific journals. Even the national hero of the Philippines, Dr. Jose Rizal, was able to obtain cannabis resin from a drugstore. So it means that in the 1800s, even the Philippines, cannabis was available in a drugstore. So it was medicine already, even before the global prohibition. So, we hear about the endocannabinoid system a lot, no? It's basically a 600 million year old system. As Dr. Te mentioned earlier, it's not some wires or tubes or some muscles, or it's a signaling system. So it's an interface for all other systems. It's a signaling system in between. Someone talked here about the mycorrhizae and all the how plants are interconnected. That's kind of like how it is also with our organ systems. So it is composed of naturally occurring cannabinoids in our body, the receptors, and the ones that produce and degrade, transport the cannabinoids. So the endocannabinoid system again is the one that maintains one of the few systems that maintains balance in our body. That's why it's called the universal regulator. So in the central nervous system alone, it regulates memory, learning, sleep, locomotion, in movement, food intake, pain, attention, mood, lots of different stuff. And not just in the central nervous system, again, everywhere in our body, not just uh, in from the uterus, but even before that, even in gametogenesis, in the sperm and the egg, it's the endocannabinoid system is important. So from cradle to the grave, the endocannabinoid system is important. And as new as the concept of endocannabinoid system is, it's even being expanded into the endocannabinoid dome. No? So it's much more a larger network and interface of ligands and receptors. No? So we're just coming to absorb this. It was mentioned that medical cannabis blurs the lines between the medical, health and wellness, and even the recreational. But even the concept of medicine itself, from the one drug, one indication philosophy, we're beginning to understand that there is beauty in complexity, and we have to respect, we have to work within these complexities in the human body in order to treat diseases. So, uh, again, the fully functioning endocannabinoid system is necessary for health. Dr. Te mentioned earlier about the endocannabinoid deficiency. Uh, of course, it could go both ways. What we want, of course, is homeostasis, no balance. So, but the answers to these problems can be found also within the cannabis plant itself, no? If you need the regular stimulation, just like what the endocannabinoids do, anandamide, the bliss molecule, there are CB1 um, agonists or activators, you have that with THC. On the other hand, if you want to go the other way in balancing the endocannabinoid system, specifically if you want a negative allosteric modulation, you're gonna go with CBD. So it's a very complete and new kind of therapy. The difference, of course, between THC and the endocannabinoids is just the manner of binding. It's that the THC is 3 times more potent at the CB1 receptor than these naturally occurring endocannabinoids, no? And of course, again, it says here CBD is inverse agonist antagonist, but much recent research is showing that it's a negative allosteric modulator, no? So orthosteric site is the actual like regular binding site, while allosteric site is the like not the regular site. So CBD binds there in a negative fashion, so it's negative allosteric modulation, no? Other than that, as we know, aside from the CB1, CB2, there are other receptors in the ECS, and cannabinoids, the other cannabinoids have action with them as well, especially concerning with CBD, the 5-HT or the serotonin receptor. This is probably why the anti-anxiety and antidepressant effects of CBD is might be because of the serotonin receptor. So, as it stands right now, as we all know, there is already marketing authorization for cannabinoids for these conditions, no? Uh, wasting syndrome, epilepsy, multiple sclerosis, nausea and vomiting, and chronic pain. But that's just the moment that's gonna still grow, no? There are more indications coming up, I'm sure. But in terms of the quality of evidence, uh, so it's already clinically proven the health benefits of cannabis. You compare that if you review, because not all research is the same. There is low quality evidence and there's high quality evidence. The evidence on harm is actually of low quality. So, just technically speaking, the quality of evidence for benefit outweighs the quality of evidence for harm. So, if you go to clinicaltrials.gov, you can see ongoing and future clinical trials, no? If you use the word cannabis, so 259 active and future trials on cannabis, and around 60 with the keyword cannabinoid, no? These are the clinical trials. So there will be more indications to come, definitely. Because, of course, absence of a clinical trial does not mean absence of efficacy. It's just like the formal way, uh, the conventional way of calling something medicine, of course, is the randomized clinical trials. So, also in the real world, there is real world evidence that cannabis is able to replace, no, multiple medications, different indications across drug classes. not just wean off people from medicines, but also other recreational substances as well and dangerous drugs. So those are the indications, no, and the treatments which cannabis can be applied in treating disease. We go now, I think, to a much more maybe a very potentially benefiting cause, of course, which is the prevention of disease. So, of course, it is very uh, uh, one of the main harbingers of disease, of course, is the aging process. We naturally age, usually because of the uh, the telomere shortening or uh, antioxidant and free radical damage on the cells, no, brought about by inflammation. So CBD being an anti-inflammatory, mainly CBD, but of course other cannabinoids can be anti-inflammatory. If you see here, the decrease in the inflammatory chemicals, much of the studies really is pointing to CBD in the red. No? THC, CBG just a bit. And there's some evidence actually to say that THC is pro-inflammatory. But overall, when you're looking for anti-inflammatory, it's more on CBD. Aside from that, again, being antioxidant directly and indirectly. So directly because it is able to neutralize CBD THC is able to neutralize free radicals even better than vitamin E or other known uh, antioxidants. So, through their antioxidant and anti-inflammatory effects, they can slow down, prevent, and maybe reverse the aging process. So aside from that, of course, in preventing aging or slowing down aging will also theoretically prevent disease. Also, the role of cannabinoids versus stress. So the endocannabinoid system is one of the key regulators of the stress response and is important for proper return to non-stressed state. It is also important for the habituation of the stress response so that you won't get stressed the next time a stressor is around, no? Lessening our of course the stress response is protective. It confers an evolutionary advantage. That's why it's still around. uh, there are valid reasons to turn on a stress response, the flight or flight response. But in modern life, it's the chronic stimulation of the stress response, uh, traffic or whatever, workplace or home, a conflict or whatever stressor it is. It's gonna wear down on your health. So cannabis, although it is being used as of course to unwind, relax, it's not just for mental stress. It's actually really for the actual physical stress response of the body. It works in the hypothalamic pituitary adrenal axis, no, which is the one responsible for cortisol, the steroids, no, to part of the fight or flight response. The adrenaline, of course, is part of this system that we get with the fight or flight response. So the endocannabinoid system is part of the brakes, the system that puts on the brakes to this stress response. So that's the role of cannabis in the treatment and prevention of disease. Now, a bit technical stuff, just to let you know about the Philippine landscape. So, 6 out of 10 Filipinos aged 10 to 69 have used drugs, and of the drugs they use, it's mostly marijuana followed by shabu, no? So 2 out of 100, so 2% are current users, no? 2%, but then only half of that is cannabis. So about 1% of the adult population of the Philippines is using cannabis, a country of 140 million. Not as high as the French do, which are 10% of the population. Not as high as the global average in 2020, which was 4%, the global users of cannabis. Mhm. Okay. So the only legal way to access cannabinoids in the Philippines is through importation of purified CBD, Epidiolex, and only those with Dravet syndrome and Lennox-Gastaut syndrome, pediatric epilepsy can avail, and only neurologists can prescribe. uh, Philippine the government agencies are very proud to issue one compassionate special permit, but after the patient got hold of that permit, they didn't have $32,000 a year to buy for that. So it's legally accessible, but is still virtually inaccessible. So that's why parents petitioned the Dangerous Drug Board to follow the UN recommendations to reschedule cannabis and cannabis resin, the whole plant, and also to decriminalize CBD, no? Just like the recommendation of the World Health Organization. Also, there is legislation in the Senate, no? Yours truly was invited in the two hearings about the proposed legislation to legalize uh, government supervised medical cannabis program for qualified patients. And there are multiple versions of that bill in the lower house. But there is also, again, a Congress bill to decriminalize medical use and to decriminalize, remove totally for all uses. Basically, just what Thailand did. So there's also a bill on that. This is the latest, actually, filed just last month. So with that said, thank you very much to all our again participants and to all the viewers at home. You can catch all the presentations in the think tank, and don't go yet because we still have one more speaker, Sarah, and we